Hi, this is Dr. Keith Lewis of ThyroidColumbus.com. What do you do when you have all the classic symptoms of low-functioning thyroid or hypothyroidism, and you go to the doctor, he performs laboratory tests, and he looks at you and says, "Mrs. Jones, your lab work is normal, but you're tired, excessively tired, can't get enough sleep, you're constipated chronically. You ache all over. You're depressed. Your hair's falling out." What do you think? Do you think you're crazy? Well, I have many patients that come to me and say that. They've been to the doctor. He said my tests are normal. I must be crazy. And oftentimes the patient comes in, they've got a prescription of an antidepressant or an anti-anxiety medication in their hand and just felt completely defeated. I mean, oftentimes to tears. Well, as I tell many of those patients, I have them bring their laboratory work in, and oftentimes the doctor, their family doctor, has only performed a TSH or thyroid stimulating hormone, and if those ranges were within normal ranges, they felt the patient was normal. Some doctors will do a TSH and another test called T4, which is tetraiodothyronine, and sometimes those tests are even within normal ranges. So again, once we do a history on a patient and realize that, really the patient is experiencing symptoms of hypothyroidism, we do a complete thyroid blood panel to determine, again, whether or not they truly have hypothyroidism. That test includes not just TSH and T4, but also T3, which is triiodothyronine. We check for thyroid peroxidase antibodies. We check for thyroid binding globulin antibodies. We also check the free forms of the hormones, free T4, free T3, which really tell us what your body's utilizing, not just what's in the bloodstream. We also check for reverse T3. We check for thyroid uptake. And by doing these particular tests, we get a pretty good sampling of what that thyroid is doing or how it's functioning, or in most cases, how it's not functioning. After all, there are 27 million Americans right now that have hypothyroidism and aren't even aware of it. And many of those people have had those laboratory tests done, the TSH and maybe the T4, and they are so-called within normal ranges. So again, you got to get the entire blood chemistry, the blood panel done, if you're really going to be able to determine if you do indeed have a thyroid problem. For more information, contact us at thyroidcolumbus.com. Until next time, this is Dr. Keith Lewis.